Thank you for inviting me. I'm Carl Gutowski. I'm a plastic surgeon from Chicago. I agree with Dr. Schwartz. The staging and the types of lipedema are kind of not very useful as surgeons, and kind of how we approach this, kind of to simplify it. If someone has symptoms, we treat them. So I'm going to talk about the different types of liposuction that are available. This is a liposuction cannula. It's been around for over 40 years, and I can't believe it. We still have debates on what is the best technique. And some of these debates are real, some are probably artificial, some are driven by industry. Probably most of them are driven by industry, the guys that make the machines want to sell the machines. And so then there's stuff out there about you got to use this one, you got to use that one. I'm just kind of talking right now until my slides get pulled up. But this cannula can be your friend, but it's really the person at the end of the cannula that will do the good job, okay? So I'm gonna try to kind of give you my thoughts that are somewhat evidence-based. When we don't have evidence, we're gonna try to use opinion to fill in the gaps. There we go. I have no disclosures. So what I want to talk about is differentiate the different types of liposuction, talk a little about the difference between evidence-based and social media-based recommendations, talk about high volume, which is more than 5 liters or 5 quarts, talk about the type of anesthesia that can be used and where you should do this, and then understand what can be done to tighten skin. So my background, I've actually been treating lipedema patients since 2000, of over 500 lipedema procedures. I've helped some insurance companies come up with guidance on how to cover this. I've written practice guidelines for other things in plastic surgery. I've also done biomedical research and grants. So I kind of look at this from a little different perspective with my background in organized medicine and research. Studies can be graded on how powerful they are. A study where you take 100 patients, divide them into 2 groups randomly, and you treat them and follow them for 10 years, high-level study. Expert opinion, us getting up here and saying, well, this is how I do it, low level. Most liposuction studies are low level, okay? Most lipedema studies are low level. That's a problem because low level science isn't that really useful. This is from a patient comes in to me and says, I want these results, and she pulls up a doctor's website. High-def laser lipo, Vaser lipo after 3 treatments. I said, I'm not buying it. So the patient left, said she wants someone else. I went back home and I looked at this, and then I looked at the back side, and I'm like, this patient had a thigh lift, okay? So you have to be very careful what you see on the internet. Someone markets some fancy high-def Vaser lipo when they really gave the patient a thigh lift. That's not really fair, okay? So as our founding fathers said, don't believe everything you read on the internet just because there's a picture next to it. In reality, it's a process. This is one of my early lipedema patients. It took 3 surgeries, 2 rounds of liposuction, then a thigh lift with liposuction to get her to that point. It took about 1.5 years or 2. It's not magic. I don't say it's some kind of magic lipo. It's just the work that's done. These are all the different types of liposuctions that are out there. I've used all of them, and I can tell you there isn't one that's any better for lipedema, with the exception of power, but that's just easier for me. They can all be done awake. They can all be done with minimal incisions, and they can all be done with minimal bruising. It's all the other stuff that goes into it. It's not this. So I've used them all. What is tumescent liposuction? This is like a crazy question. All liposuction done in a modern era is tumescent. That just means you put a bunch of fluid in there that has some medications in it. The medications are adrenaline or epinephrine, which constricts the blood vessels so you don't bleed. Everyone has to do that. It may have some lidocaine in it to give you some local anesthetic effects. It may have a little bit of bicarbonate in it to take the edge off the injection. And it may have some tranexamic acid in there to reduce the bleeding. Everyone does tumescent. So that's just a given. There's definitions for tumescent, but pretty much everyone does it. So what are the different types of liposuction? Traditional liposuction, metal tube, sucks the fat out. It works great. I do it all the time. But if I have a lot of work to do and I'm working in some tough fat, the tube can vibrate a little bit. Little tiny vibrations break the fat up, makes it easier for the surgeon, less tiring. We can do it faster and more efficiently. Then there's ultrasound and Vaser, where they put little ultrasound tips on the end. Claims to tighten skin, 0 evidence for that, even when they've done randomized trials on it. Water-assisted lipo. I know the rep is out there. They're probably not going to like what I have to say, but no evidence that it helps. It's a little stream of Windex at the tip of this. You know, like when you spray Windex on your table, at the tip, and it's supposed to be magically make the fat come out easier or something. It doesn't. No evidence for it. Laser-assisted, smart lipo. How can you go wrong with something called smart lipo? Well, waste of time, waste of money, done hundreds of cases, no evidence for lipedema, and it would take a few days to treat a patient with this. Renuvion, here's a new thing. You inject a gas under the skin, you blow it up, it tightens the skin. Very little evidence for that, no evidence in lipedema patients, but last month the FDA issued a warning on it because it can cause burns and other kinds of problems. I would not recommend this for lipedema. Radiofrequency assisted may have a role. We do external radiofrequency in our practice, but no studies in lipedema, and the skin tightening, if any, is minimal. It's not for lipedema patients. So if you're going to get your car fixed, you don't ask what kind of tools or wrenches the mechanic's going to use. You're going to look for the mechanic's reputation and record of fixing cars. So let's talk about lipedema and liposuction. Did a PubMed search just before this meeting a week ago. Look how many studies there are in liposuction, 78, but only 15 of them are primary studies on liposuction. Out of those 15, 3 of them is the same patient cohort, just updated in time, so there's really only 13 studies. 0 comparative studies where they compared one technique to another, 0 randomized controlled studies, and 3 on lymphatic-sparing liposuction, none of which apply to lipedema. So just because something's published doesn't mean it's worthy. So let's look at the phlebology standards of care. I thought this might be an interesting thing to look at, but unfortunately what they tell us is most of the studies for lipedema use tumescent or water-assisted. But if you look at the references that they cited, that's actually not true. Most of the studies use power-assisted. That's right, power-assisted is the most commonly used in the literature that gave good results. So let's look at these. Here's some of the studies. Vibration liposuction, that's power-assisted. Here's another one, yields good results. Tumescent liposuction, but they did it with the power-assisted. And here's probably the best one where they followed patients at 4 years, then they republished the cohort at 8 years, and then just recently, 2 years ago, they published it with a 12-year follow-up, following 60 patients. The results were maintained, all of it with power liposuction. So does water liposuction matter? Well, this paper got put out where they looked at the stuff that came out after water lipo and made some rather absurd claims about it being superior, which they weren't able to show. This study just came out. It doesn't really match the patients that we see, mostly stage 1 and stage 2 with BMIs of 28. I see very few BMI 28 lipedema patients. And unfortunately, 2 of the authors actually have a conflict. They have some kind of relationship with the company that makes the water lipo. So that should raise a few eyebrows. Here's the problem. With power assisted, that's the efficiency of the fat that I remove. There's 2 liters, 95% of it is fat. With the water, it's mostly water that comes out. And that counts against the limits in some places like surgery centers in different states. Where should it be done? High volume should probably be done with observation in a medical facility because you can have problems with it. This is someone I took out 19.5 liters, so about 31 pounds of fat. Of course, she's going to spend the night in the hospital with IV fluids, urinary output monitoring to do it safe. How much can be removed? This is a study I co-authored quite a while ago on evidence-based guidelines in liposuction. It's an arbitrary limit, but most states and most surgery centers follow these guidelines. More than 5 liters or 5 quarts, they should be observed, shouldn't be sent home. Is there a limit? Another study we co-authored, largest database of plastic surgery cases in the world, looked at liposuction. Patients with a higher BMI, which is most lipedema patients, probably can remove more safely, which is different than if you're doing liposuction on a 100-pound person. So anesthesia, it can be done safely awake with local anesthetics, but if you're doing high volume, you probably should consider at least some kind of anesthesia provider there. And there's a limit as to how much you can do awake because of the lidocaine, the local anesthetic, can become toxic if you do too much of it. So here's fully awake tumescent anesthesia. I'm doing calves and knees. You can get pretty aggressive all the way down to the ankles. You can see how you can get the skin. This patient's awake. She's talking to me about her family. Skin tightening. I'm going to skip over the studies because none of them have been done on liposuction patients. A few have been done on cosmetic patients that are very well selected to have tight skin anyway. But with a stage 1 young patient with good skin, you can do any kind of liposuction you want. You can do magic liposuction. It doesn't matter. You're going to get a good result. Same thing here. Calf skin, it's going to tighten down. Stage 1 or stage 2, young patient, that's a no-brainer. But stage 2 and 3, skin's a little looser, older patient. You can see the calves shrink down, but look at those knees. That's an area of movement. That skin's going to be loose no matter what. I've actually cut it out in those cases. Here's a patient. I know she's going to have loose skin. She doesn't want loose skin. Do I tell her I do magic lipo to tighten it? No, I tell her the truth. We're going to cut it out. And so I did an upper thigh lift. So you can see she's got the gap between the thighs that everybody wants. The skin's not rubbing together because she had a skin excision. You got excised skin. Nothing else is going to tighten it. Now, here's a patient, she wanted to stage it. So liposuction, you can see how loose the skin got. Nothing magic's going to tighten that. And then you come back and do the skin excision. Here's another staged patient, did 2 rounds of liposuction, then did the body lift and the skin excision. of the thighs. When you see this in the buttock, liposuction alone is not going to fix this. You got to cut it out. You can do it in stages. You can do it at the same time. I've done both. It just depends on kind of what else we're doing. Same thing with the arms. Someone earlier today, they were talking about massive weight loss patients who still continue to have symptoms in their arms or legs because they've got lipedema there. You got to cut it out. Liposuction isn't going to help there. So, and in these cases, it takes a multiple approach. I got her going pretty far, and she sent me a picture from home what her legs are. This is after 3 procedures. So it's doable. It just takes some time, but you got to cut the skin out. It's not going to tighten magically. So don't believe everything you see on the internet. Don't pay for things that don't work. In most cases, power assisted is the way to go, but it's really the surgeon who determines the results. Don't expect tight skin after liposuction. You may need a skin excision. Thank you.